Hello everyone. Today we'll be talking about paroxysmal nocturnal dyspnea. Paroxysmal nocturnal dyspnea is a sensation of shortness of breath that awakens the patient often after 1 or 2 hours of sleep and is usually relieved in the upright position. So as we all know, orthopnea is defined as whenever the patient feels breathlessness in recumbent position, that is in either supine or prone position. Whenever the patient is lying flat, the patient will feel breathless, and that is called as orthopnea. But that breathlessness will occur immediately after lying down. Whereas paroxysmal nocturnal dyspnea, the breathlessness does not occur immediately. It takes some time. It is around after 1 or 2 hours of sleep. And usually the symptoms get relieved in upright position. The patient will be sleeping in this position initially, and after 1 or 2 hours, patient suddenly sits and he gets cough, frothy sputum, dyspnea, and that gets relieved after sitting position. So it is commonly seen in patients with left heart failure, both in acute left ventricular failure or in left ventricular inflow obstruction like mitral stenosis. Mechanism: there have been 5 theories which has been said that why paroxysmal nocturnal dyspnea occurs. First mechanism is in supine position. What happens is that there is slow absorption of extracellular and extravascular fluid into the intravascular compartment. So when the patient lie down in the supine position, the extracellular as well as the extravascular fluid will come into the intravascular compartment. So intravascular fluid blood will get increased, the volume will get increased. All this blood will come into the in supine position will go towards the heart. Because the heart is not functioning properly, there is left ventricular failure. What happens is all this blood which is coming to the left ventricle will now go back to the pulmonary veins, and from there it goes into the lungs, causing the pulmonary edema, and the patient start feeling breathlessness. So slow absorption is to increase venous return and lead to dyspnea. The first basic mechanism for it. Second mechanism which has been suggested that there is decreased sympathetic activity during sleep. So what happens is whenever we sleep, during sleep there is decreased activity of the sympathetic system. So sympathetic system is generally protective in case of any whenever a danger occurs to the body. So whenever there is an increased venous return, normally what happens during awakening time, if there is increased venous return which is occurring, the sympathetic system is activated. So the sympathetic system activation will lead to what? It will lead to increased heart contractility and increase in heart rate. Thus, all the blood which has come to the heart is able to pump down to the circulation again. During sleep, the sympathetic system gets deactivated, and this is very much reduced. So this compensating mechanism is lost, and thus patient gets breathless. Third mechanism is said to be because of elevation of diaphragm. So whenever you lie down, the diaphragm is slightly elevated and it compresses the lung. So the compression of this lung as well can lead to breathlessness. So elevation of diaphragm is the other mechanism. Depression of respiratory centers during sleep. During sleep, what happens is the respiratory centers get depressed. Normally, whenever you are awake and if there is any breathlessness due to the response to hypoxia or hypercapnia, respiratory centers get activated, and the mechanism starts activation, sympathetic activation occurs, and the patient starts getting will take faster and faster breather or tachypneic faster breathing to compensate for the hypoxia and hypercapnia. But during sleep, this mechanism is lost. Thus, patient may get again breathlessness and awakens after 1 to 2 hours. Last mechanism which has been suggested is because of the transient nocturnal arrhythmias which occurs during the nighttime. The nighttime there are arrhythmias can occur. These arrhythmias can actually trigger a sudden heart failure and can lead to paroxysmal nocturnal dyspnea.